physicians, some of the most important tenets are to do no harm and to act in the best interest of the patient. While those seem like they should be straightforward tasks, sometimes they really aren't. Sometimes a patient is unable to communicate his or her wishes. Sometimes it isn't obvious which family member should be making decisions on the patient's behalf. Sometimes families need to process their feelings and even guilt about deciding to end life-sustaining treatments. Sometimes clinicians need guidance or support while making decisions in difficult cases. These are all situations in which I would call ethics advisors. Their professional ethicists can help clinicians and families make sure that the medical care provided is truly in the best interest of the patient.
I'm Alexandra Perry, and I'm the Chief Executive Officer for Ethics Advisors.
And I'm Karen Tangway, and I'm the Chief Ethics Officer for Ethics Advisors.
We're really excited to be entering the FedEx Small Business Grant Competition. We use FedEx services a lot to mail contracts back and forth and help us with printing our marketing materials, and also especially for notarization services. So winning the FedEx Small Business Competition would really allow us to accelerate our business. One of our big goals for this year is to develop a virtual platform for continuing education to allow frontline providers to access continuing ethics education virtually.
Funds from this competition would also allow us to create an ethics consult database, which is really important for being able to review consults with staff and also part of an education opportunity.
Karen and I have worked in clinical ethics for a number of years, and we've always been blessed to work for big healthcare systems that really have support for clinical ethics. We've seen firsthand what a difference it can make in patient cases when there's access to ethics services.
The coronavirus pandemic has changed so much about the world around us. Hospitals have needed to find ways to minimize the numbers of staff present within their buildings. The result of this has been hospitals and physicians are increasingly turning towards virtual methods of consultations with specialists. So we feel very confident that the virtual consultations ethics advisors can provide are an ideal solution to meet the increasing need for access to clinical ethics services.
Our mission at Ethics Advisors is to provide our clients with the best ethical advice in the most difficult patient care scenarios. To me, what that means is we're providing an extra layer of support for providers, being that listening ear if they need one. It's those situations in which the distinction between what is right and wrong is not so obvious, and the path forward towards a solution is not so clear. That is when we're here as Ethics Advisors to provide that support to our clients. At the end of the day, I think it's so important that we remember patients have stories, they have memories, and they have things that they bring with them into the hospital that impact the decisions that are made every day in clinical care. And that's why I think clinical ethics is so important.